Let's go live. This is Deputy Minister David Makgobo.
Our Deputy Minister and the Minister of Water and Sanitation has assigned the two Deputy Ministers. We've agreed now that we are creating a command center so that our response can be immediate and it must be effective. The command center that is going to be here is going to be at two levels. It's going to be both at a political level, but it will also be at a level that is technical. At a political level will be led by the Ministry of Health. Dr. Dlomo will be leading us here, supported by the MEC for Health in the province, Meno Mantu as our MEC responsible. The Department of Water, the Minister of Water will be part of the team. The Ministry and the Provincial Department of Social Development will be here. We will also have the City of Tshwane where these issues are happening, led by the Executive Mayor and the MMCs. But at a particular point, we'll also bring in the police and we'll also bring in the Department of Defense to handle the issues that are happening here. At a technical level, we have established a multidisciplinary teams. They are all reporting to the Director General of the Department of Health, Dr. Telezi. Shenge is leading those teams. And we have decided that there are going to be different streams that are currently hard at work attending to the issues. There's a stream that is dealing with issues of health, so that the number of people that are requiring health, the issues of attention in our medical facilities. Our facilities have the ability to respond, whether in terms of capacity, in terms of human resources, and all other the associated logistics and medical. It's going to be very important that that team works very hard and be supported to deal with that particular issue. But also that team will also be doing the issues of scanning, the issues of mobility, so that this matter can be contained in one environment so that it doesn't spread, because a number of people are being moving. And there's that particular team led by the Ministry of Health that they are attending to this issue so that our neighboring provinces, including the neighboring urban areas around Tshwane, including in Gauteng, they are not affected. We will also have a team of social development. As we know now, there are a number of families that have lost their loved ones, and that team will be in a position to give social relief. In other ways, to be with those families, but more importantly, to give psychosocial support and also to deal with other matters on the basis of the guidance by this command center. Another team is going to be dealing with issues of water and sanitation. One of the most important issues that we've made a decision as a leadership is that a formal investigation is going to be undertaken, so that we are in a position to determine what caused this problem of water contamination, whether there is any negligence on any part of any individual or any institution. A team of experts has already been established. They are led by two DDGs in the Department of Water and Sanitation, and those DDGs are engineers. They know the business of water. They will be able to look at all the sources that this city of Tshwane, they are able to get water in the main, the Mahali system, the rainwater system, and the system itself that is managed by Tshwane that deals with your timber water treatment works. That team will also be in a position to do a follow-through, whether the issues of the model of provision of water, because we know that the timber system is contaminated, and that water is not fit for human consumption, but it could be used for other activities like washing, laundry, the issues of gardening. Whether the water trucks that are providing, where they are taking the water, is that water of good quality? Whether is it fit for use? And in a number of these communities where these incidents have happened, we know that there are static tanks that are posted in various communities. We would also have to check the issues of health and hygiene and deal with those particular issues. While the investigation is continuing, there is an immediate task of the provision of water of those communities that are being affected, including the centers, like the schools, the hospitals, and so forth, that are being affected. We have been assured by the leadership of Tshwane, the MMC, FOSI, that is CM, that there is sufficient tracking that will happen in terms of that particular issues of water, and we'll be in a position that working with them and DM Shabalala, we've been tasked by the task team that will follow through, ensuring that those tankers, there's a clear schedule, the numbers are correct, there's clear lines who's driving them, but also the quality is good. And the results of this water that is being provided by tankering is going to be very important that we always advertise them, publicize that this is how it looks. And we have also agreed that we will run some tests. And these tests, they will be run with a reputable institution. We are looking at our institution like the CSIR and Water Research Commission, that if all those samples in terms of the investigation they are taken, we should be in a position to have CSIR and Water Research Commission, because that information will be shared with the public. But equally, if there is any capability, that information can also be used by law enforcement agencies, because there must be accountability for this incident. The last component in our task team will deal with issues of engagement with our communities, because they are affected, they are councillors, they are community structures, and how communities will take responsibility in terms of ensuring that the water that they receive is properly treated, they are given either the sachets, and all these other issues that we need to be able to do, issues of hygienic education, because we don't want any spread that will happen. Then from there we'll be able, then the teams that will deal with issues of communication, led by our communications team, they will be able to continuously interact with yourselves so that we can be in a position to keep the nation informed. But we are handling the situation. It's very, very unfortunate, and we need to be able to arrest this incident. And we are very hopeful that working with the leadership of all the structures and community leaders and the citizens themselves, we should be able to avoid any death or any spread in our communities. That's the brief message that we thought we should be able to share with you here. Immediately after this leadership, they have noted that there are certain members of the communities that are outside. We'll be able to brief them. The men have briefed you, and a number of us that will belong to different streams will take our responsibilities to visit those structures that we need to engage with, and then later on, led by the Secretariat, which is coordinating the technical teams through the DG of Health, Sheng, he will be able to advise us when is our next meeting, so that there is a continuous update on the work we do. I will hand over to the leadership of the Department of Health, led by Dr. Dlomo, so that other matters we can be in a position to conclusively conclude our briefing.
Thank you very much, my colleague, Deputy Minister Mahlobo. Greetings to all, Deputy Minister Shabalala, MEC, Gauteng, my dear sister, and all leadership here, including our DG, MMC. Deputy Minister Mahlobo has actually given an overall plan and our intervention package, how we really want to move on. But I think it would be important to update you of this outbreak, we call it an outbreak of cholera, caused by a bacteria called Vibrio cholera. Now, this we have 41 cases now countrywide. Let me start with the easiest to remember. There's one in Limpopo, I think Gianni Messina, who has a travel history from around where we are. So we can link that case to around here. There are 6 cases in Free State. I remember the place, Fredefort in Paris. There are 6 cases there confirmed to be of cholera. There are 8 deaths that were reported in the Free State. We have not really associated those diarrheal deaths with this Vibrio, so we cannot confirm or comment on those 8 cases. What we know now is that there are 6 cases in Fredefort in the Free State that are confirmed to have Vibrio cholera, no death as yet. Around where we are, there are 34 cases altogether, so it gets to count all that, it gives you 41. Of those 34, since we woke up this morning with 12, 13 later on, now there are 15 confirmed deaths around where we are. And I was just speaking to the MEC here to say, sometimes when you have this infection and you are admitted yesterday, 2 days ago, we hope to get people to survive because of the interventions. Sometimes we will actually go and visit and confirm. It probably DM is related to getting an infection on a body that is already challenged by many other things, could be even poverty and just not being well, so that you are not able to withstand the challenges. So after you have been in the hospital for 2 to 3 days, you should probably be getting better because of the intervention that we put. And it's a very known intervention. We've had cholera prior to 1994, and we know how to deal with it. So we just want to say this plan is very helpful to us, because as a healthcare worker, all that you do is to provide medical intervention. The source of water being a challenge, we leave it to the water experts to support us in that. But it also underlines these issues that are very critical in terms of health. Is so much embedded on the social determinants of health in the whole world, and therefore it is very important that we need to, because I'm very delighted that we are not here alone as health, but we have this support of creating a base of where to intervene, how to intervene, because in that case, once we have that plan and it works, I can assure you there will be less and less cases coming into our hospitals. But number two, we have also, the DG has actually issued an alert to all provinces that any person who presents to our facilities with diarrheal disease, we should have a high index of suspicion that it could be cholera until proven otherwise. Therefore, because cholera is very different from any other diarrhea, it is rapid dehydration. Within an hour, you've lost quite a lot. So we want to really alert all our healthcare workers everywhere where they're working, to say, let's treat any diarrheal disease that is presenting to our health facilities as if it was cholera, because then our intervention will be that quick. Thank you very much.
Okay. Before we take questions, I want to check with the MEC if you want to make any inputs. The Deputy Minister, MMC, any inputs?
No, I think we've covered everything. All I can just say is that we've activated the job, and there's a mobile unit here in the grounds of the hospital to assist the hospital, and they will help also with screening of patients. And we've also sent out some of our peer educators to go from door to door to go and teach people how to manage the water and themselves, and if they have any symptoms, they must go to the nearest facility. Thank you so much.
Okay, thanks very much.
Just one round, then we run anyway.
We are going to take one round of questions, but if you strongly feel that your question has been answered, just say Kilakade without repeating that question. So we want to start from this side, going this side. I see only a few questions. Our political principles were very clear on that one. It'll be number 1, number 2, number 3, 4. Just one journalist, one question. So we have to, number 1, number 2, 3, 4, 5, 6, 7. Just note your number. 7, 8, 9, 10. So this side, if you strongly feel that your question has been answered this side, please, you don't have to repeat it, just note the response. So, Zikona, one very short and straightforward.
Just the Deputy Minister, with regards to the command center.
Just before, just introduce yourself and the media house.
My name is Zikona from News from Africa. To the Deputy Minister, with regards to the command center, what does it exactly mean? To the layman, what is the command center being erected at this facility? What will it involve?
Thank you.
Lerato Mota from PowerFM. My question is addressed to the Deputy Minister. Deputy Minister, I hear that you're saying that investigations will be conducted, but then in the interim, is there a plan in place to ensure that the residents of Hammanskraal do get clean drinkable water? Because we've been doing quite a number of interviews with the community, and there seems to be a lot of panic as to which source of water must they now rely on, saying that for the longest of time we've known that the residents here have not been consuming water from tap water, but instead relying on water tankers, and they've for the longest of time as well, complained to say that these water tankers are not enclosed. So they've raised that concern and saying that now where do they go? Which water source must they now trust, the water tankers or the tap water?
SABC News. Minister Mashabo, you've mentioned the interventions and you'll be roping in various people, including the army, the deployment. The water issue has been ongoing for years now. So my question is, how is it possible for you to do? Why did it take you so long to put in these interventions? Was it not possible to put in these interventions when communities have been crying for years and years about the issues? Did it have to take people dying for government to intervene?
My colleague is covering this.
Thank you very much.
So this morning, I'm Catherine Cheng, I'm with Reuters News. This morning, the South African Human Rights Commission said that they had released a report in 2009 already, saying that especially the Temba water source is not fit for consumption. They've also looked at water sources elsewhere, and to be honest, across the country, where we have highly polluted water sources. Why is there nothing being done, and what are you going to do about the water? Because now you just said, we're just not going to use Temba for water sources, it's going to be used for gardening. Unfortunately, I have a feeling people still get access to that water, they still use it. And why have you not done anything to the dirty water sources, and what are you going to do in the future? Because you now have a task team, but you have not really said anything about cleaning up the water or addressing pollution.
Thank you. Jones?
Minister Pulele Chiti Jones, ENCA. I just wanted to find out what has been the problem here, because the ANC Tshwane caucus says that they had already told the DA to hand over the project to national government to resolve this issue. But there's been a delay for years and they've been refusing to actually have the project handed over to national. Will this be part and parcel of your investigations? Was this as a result of politicking that has now delayed and in essence affects the residents in this area as well? Thanks.
Thank you.
It's a very brief one from me. This is the Department of Health.
The name?
Sorry, Assad Adams from Network 24. Thank you. Just to the department, do we know exactly where these deaths occurred? Was it in the people's homes? Did they die at home? Or was it 15 deaths inside the hospital? And then just to add to what both of my colleagues said on that side, Minister, Deputy Minister, it's quite worrying that you're now saying that the water can just be used for gardening and for baths and for laundry and stuff like that. Are you in actual fact then saying that the water is indeed not safe, but then still telling people to use it for other activities inside their household? That's a very worrying statement, and I would like you to just perhaps elaborate on it. Thank you.
Thank you. Maschab?
Right. Maschab Asipularo from Pretoria FM. My question is mainly to the Department of Health. So what appears to be happening right now is rather reactive. We've known the issue with the water in Hammanskraal for time immemorial. However, it seems there's no proper awareness or education around the usage of the water, even the tanker water, which needs to be boiled to a degree, and there's some mixing or solutions that need to be added on to ensure that the water is drinkable, and that's why we are where we are right now. So the question really is about, have there been any preventative educational plans or awareness campaigns around this community to ensure that people are aware of how to use the water here? The government has not given a solution to the state of the water. However, they've also not educated the people in terms of how to use the water. My other question is around the timing. Cholera, as you've said, Deputy Minister, is easy to detect and is easy to see. The outbreak is not new. We've had a couple of cholera cases in the country already. So for us to get to 10 deaths before there's an actual red alert for the general public, but for us to know what was the delay in the communication. I don't know if the MEC would rather be the best person to answer that question. What was the delay in communicating the cholera outbreak in Hammanskraal when already we had been on alert for cholera cases in the country?
Thank you.
Cyrus from CDTN. Are we sitting on a ticking time bomb as a country? Because we have lots of communities living near polluted water sources, using that water. So it's just sort of just the tip of the iceberg, and could this get dramatically worse in the coming weeks?
Thank you. Yoli?
Yoli from News 24. Sorry, my question is to the Department of Health. I met with one of the families who lost their loved ones, and they were complaining that she came to the hospital on a Friday, and they made her like to sleep at the reception, and she was only admitted the following day. So what I want to know is, the hospital prepared for the number of people who are coming here, and is the department aware of that? Because what happened is that on that Friday, it was the granddaughter who had to clean after her, because there were not enough nurses. Even on the following day, there were only 2 nurses who were working.
Thank you, colleagues, for all the questions. I'm going to hand over to our leaders.
There's a colleague with a question.
That's why I hope the delay before you take on.
No, it is responded.
Sorry?
Let's respond first.
Let them read, then we'll make the inputs after they've
okay.
responded.
No, I must. Thanks for the questions, and the other members here in the panel will respond. The command center is an interim management. It's a coordinating structure. It's a coordinating structure to coordinate our efforts. And if you could see, this coordinating structure is bringing different spheres of government. And it's also bringing in different expertise, so that we are able as government to respond in a seamless way, but in a coordinated way. That's why we indicated that from national government, the Ministry of Health is here and is leading us on this particular matter, supported by the relevant in the province, the MEC for health and so forth, until at a local government level, which is a municipality. There are matters of water. That's why the Minister of Water, Comrade Senzo Mtunu, the 2 deputy ministers you see us here, we are responding to those issues, but we're working with our counterpart in the municipality, Temba Fosi, the MMC, because that's what will work. But remember the streams we gave. There are matters around social relief. Your other colleagues are saying they've met one particular family. There are matters of psychosocial support that we must attend to. To lose a loved one, some of them, I don't know the profile of these individuals. Others might even be breadwinners. That family during this time, they must be supported, even beyond. That's the responsibility of government. But there are other humanitarian relief that must be dealt with. That's how I can actually categorize it. But this, at a level that is politically, there is a team that is of experts in terms of administration, led by our DG, Usheng, so that all these matters are properly processed. The issue of water in Tshwane has been a problem for a number of years. And there have been problems politically. That municipality over time, there have been issues of conflicts in such a way that the citizens were exposed, became vulnerable. And even now, you know that there is issues of coalition governments. A very, very kind of a new feature in South Africa, very unstable. I was telling Temba this morning that it's very dangerous to work with you, because I don't know whether tomorrow we'll wake up, you'll still be the MMC for infrastructure. They change like chairs. That's what is happening. And it creates instability. As this Department of National Water and Sanitation, we know that we have intervened on several occasions, including the South African Human Rights Commission. The citizens themselves, they've been able to stand up. And many instances, our engagement with Tshwane has not been very productive. We'll agree with them, we'll put a plan, they will default. And the citizens, in terms of their right to have access to water, will be affected. The water pollution around many wastewater treatment works of Tshwane is not good. Tshwane has never made a provision that when its population and its contribution to the GDP grew, they expanded their wastewater treatment works. And their wastewater treatments are actually dysfunctional. Whether you look at Paviansport, you look at Rooival, you name all of them, the pollution that is coming here, impacting on the environment, including impacting on human lives right now, is a challenge that we experience. We've made decision. One of the decisions that we made when the Human Rights Commission was here, we worked together with Tshwane. We produced a concrete plan. That plan was presented to Parliament. And Parliament was very satisfied because even the Portfolio Committee of Water came there. Guess what? There was a default in terms of the implementation of the plan by the Water Services Authority. Ultimately, when there was non-compliance, we issued directives in terms of the law that you are breaking your water license condition. What you are discharging, whether to the Apis River, Henops, and so forth, is not acceptable. Correct it, put remedial action. We'll agree, but it will not happen. We know now that ultimately we have taken the Tshwane as a Water Services Authority, taken them to court. Because we cannot say as government we cannot intervene. When we've taken them to court, they are opposing that. But recently, there's a new leadership in Tshwane. You remember the revolving chairs. The new mayor with the MMCs, now they've approached us to say, let's get out of matters of court. Let's agree that there are serious issues around water provision. And this place called Hammanskraal, including Bronkhorstspruit, are the most affected areas. We know that. Ultimately, last Wednesday, we agreed that the DG of Water and the MM in that particular Tshwane, they must be able to refine the plan in the next few days. And then we'll convene the meeting with the minister to ensure that we conclude that plan. But because of our experience in Tshwane, in terms of institutional instability, we'll want that plan agreed with the current leadership of Tshwane that it becomes a court order in terms of declaration. So to whoever comes in, if they do this merry-goes-around in terms of their chairs, nobody can be in a position to say, no, we're not binded by that particular plan. But we are intervening, and it's a serious matter. National, working with the Treasury, working with Human Settlement, including DPSA, who are very prepared to support that the people of Tshwane, they must be able to receive the water that is top standard in terms of the science, in terms of drinking water. This is what we've been doing over time. It has been very difficult in terms of intergovernmental relations and cooperation. Remember, Tshwane was once dissolved by the province. They challenged the matters in court. But where we stand, there is an agreement that Tshwane, as a Water Services Authority, it has capacity problems. And the function is not being discharged to the level where we can be satisfied. We will give the leadership that is led by the new mayor and the new MMC the opportunity, because we've agreed to resolve this. This incident that has happened is not that we wanted to be able to do investigation over investigation. I explained there are three systems there. There's a system of rainwater, there's a system of Magalies water, but there's a system that is managed by Tshwane itself. If you look at the two systems, because the water that is provided by the water boards, we oversee them. If, let's say, the water was contaminated in the main pipeline from rainwater and Magalies, this incident of this outbreak will be affecting the entire Tshwane. Therefore, now we are trying to zoom into the other remaining system. The possibility that the timber plant, because the timber plant is still functioning, it treats water. And when it treats water, that water that is there is not fit for human consumption. There's a difference. The water can be of different qualities, but the uses, they need different quality. For gardening and the issue for laundry, you don't need the water to be on the same standard like in terms of sands when we are actually going to do human consumption. There's always been an understanding and a communication that citizens, that water in the tap, you can use it, but don't use it for human consumption. But we must be in a position to admit that probably civic education and communication must be continuous. That it must be continuous so that you don't experience this thing. If you look at the water that is coming through the water tanks are getting water from the rainwater system, and they are getting water from the Magalies system. This thing has been happening over time. There have never been incident where you have an outbreak to say that water from the water trucks is contaminated. Therefore, the view that the water that comes from the water trucks must be boiled, you must add chlorine and all these other things is not there. But then where does the water actually get into? It gets into the truck. That investigation must be able to say, is that water truck in a condition that it doesn't have any contaminants or foreign objects? That water in those communities, they put them in a JoJo tanks there, those static tanks. And when you put the water in the static tank, is it secured? Is there no possibility of people throwing in foreign objects? In our own experience, we know that in certain communities, foreign objects that are being thrown in there. There has to be issues of security. Therefore, I thought we should be able to clarify that these are some of the issues. We know that the Rooiwal system is the epicenter of the problem. And the municipality started work there. We supervise that they do work, but unfortunately, they've terminated the contractor there. Probably at a particular point, the MMC must come in. The work that must actually improve the capacity of the plant, but also work on the oxidation system and the aerators that they are working in the chlorination system. It has not been completed. And we have learned that through their own advice, they are dealing with issues of procurement. But it's going to be important so that people must have water coming out of the taps, not the interim measure of providing water through water trucks. But even the municipality itself is losing money. If you provide water through water tankering, the revenue you lose is part of your non-revenue water. But if it comes from the tap, you should be able to bill. But we will support this Water Services Authority. Is not in a good shape in dealing with the issues, and there is a commitment, if I may say, from the municipality, like they've said. But because of our experience, a court declaration, Babdinangwe, will be more important. I think I've addressed all those particular issues. The issues of general of water pollution in the country. South Africa, one of the biggest challenges we face, there is an increased pollution or deteriorating of water quality. Whether the valve system, you name all of them. One of the things that we have done, we've reintroduced the issues of the blue drop and the green drop. We issued it last year. And you could see the state of wastewater treatment works all over the country. Whether these municipalities are run by the ruling party or other parties, they are all the same. And the emergence of sewer running in all townships all over the country. These are the issues that we have said, let's address issues of sewer spillages, address the issues of wastewater treatment works, because they must be functional. And those are the instructions that the President has given to the Minister and all of us to be able to support municipalities. But we can still assure you that the water that is coming from the tap in South Africa is still meet the standard. Remember that water that must come from the tap, it must meet the blue drop status. And you can still drink water in South Africa. But you can't drink in any tap. There are taps that are being marked in public places. When it's marked with a red, don't take that particular water. Because in terms of that water, it has an effluent. That effluent will be able to do certain things. But it's the biggest issue that will not leave the issues of deterioration of water quality on the basis of waste treatment works, including the one that is done by industries, because industries are also polluting in a biggest way. The last pollution we're facing is groundwater. Most of the time you could see many people in villages, they have a lot of boreholes. But because the population has become dense and populated, and the number of them in terms of the sanitation facilities they use, then there is an issue of the diffusion of the fecal excrete. They get into groundwater. Therefore, the issues of monitoring of even the boreholes is an important aspect that we're looking at. But very shortly, in the next few days, we'll meet with experts. The Minister will explain more what are we doing about the deteriorating state of water in our country. But for this one, we're very sufficient to say our plan, if we implement well, work with communities, explain this thing that we have explained, we should be able to contain this thing, because if we don't contain it, Dr. Dlomo will have more problems. He will have more patients, and a number of our people will perish on the basis that water, instead of water being life, water is becoming death. Thank you.
Yeah. On the few questions that came in for health, my MEC will come in here, but the starting point is that all deaths that we are actually reporting are confirmed to have taken place in the hospital. because the only way you can be able to confirm is by actually taking a specimen, a stool specimen, into our laboratories, and therefore they confirm this is cholera, not salmonella or any other thing. So we could be able to report that all these deaths that we are reporting as cholera-related have taken place in the hospital. So which actually says to us, could there be any other deaths that are taking place outside there that we are not aware of, including those 8 that have happened in the Free State that we are not putting as our statistics because we have not confirmed that through stool specimens that those were part of a cholera outbreak. On the issues of the awareness campaigns, look, some few months back there was a cholera, there were few cholera cases that came in from Malawi and they entered mainly Gauteng. And there were actually awareness campaigns, but I don't know whether we were that strong in and around Hammanskraal on that, but we have never stopped the awareness campaigns on that. Probably the MEC can come in here to give support whether we were as strong as we would want to. On the question of you, Liswa, maybe you wanted to say this death that happened on Saturday after the reception happened not in the reception, but maybe in an admission space. Yeah, some was, and then I'm sure the hospital might also confirm, some places, because of a challenge in the wards, you may still treat patients in the admission while waiting for a bed else in the wards. But also we have learned that there's been more patients. I was talking to the MEC yesterday. There's been some patients who have really been now admitted at Steve Biko Academic Hospital and Dr. George Mukari, just to offset the increasing number of patients in and around Hammanskraal. So there may as well be a delay, but even if there's a delay in casualty admission wards, patients still get looked after there by nurses, but maybe you could add on that.
Thank you, Tim. I think, colleagues, what we've been doing, I'm sure you can see the way I dress since I've been here. I don't dress like this before. I used to dress in suits and high heels. I've stopped since I've been here for the past 6 months, because here we are focusing on educating communities on the do's and don'ts, because we want to prevent any diseases. And part of our work that we've been doing, I'm coming from Mansfield as we speak, was we've identified specific communities where we do these educational programs so that we can prevent cholera. In fact, we never stopped after those cases that we received from Deep Slot. Since that time, you follow us on social media, we have a pamphlet, we even go to communities and even teach them how to wash their hands. What is it that they must do to prevent cholera, including measles and other diseases that we've been dealing with. And then I think, Minister, you are correct. We've immediately what we have done is to activate 2 wards here, but Ward 18 is open, you can go and see it, so that we are waiting for any case that we can have an overflow here in the hospital. Besides that, we've taken others to Dr. George Mukari and Steve Biko, because we want to avoid keeping people at the accident and emergency area for a longer period like it happened. And we have staff that we have activated. We don't have a shortage of staff, because even on social media people are saying we have a shortage of staff here. I was here until 9 a.m. yesterday. There was no shortage of staff. Maybe it has happened one day, that person that was here, we can't dispute that, but now we've activated everybody, they are here. We're using even the staff from the clinics that are around the area that are helping us here, working with us to ensure that we diffuse this problem that we're experiencing. Thank you, Minister.
Thank you, DM. Thank you, DM. Before we close, I checked with the colleagues if they want to just
MMC.
MMC?
No. This one.
This side, okay. Yeah.
MMC Chamber Proceed, utilities. During the briefing, I've just received an update that at the Temba water treatment plant, it's tested negative, so we are good. So far as remnants of cholera, there's none there. I can say again that from the rainwater also, I have received the certificate. We are okay. Tested negative, and same as Mahalis. So everything is sorted out.
Okay, let me see. Yeah. Site.
You did.
No, he wants to make the input. The chief whip.
Yeah, no, thank you very much.